So this corrective action plan is from the state program review that was completed back in November of last year. I shared most of the information with you guys after the review was complete, but this is the official training that's required a part of the corrective action plan, or CAP. As always, I want to say that I appreciate how well you guys performed and how hard you work every day. It was definitely not unnoticed by the state auditors. Each report that they send starts out with program strengths, and they picked out 4. And I took one word from each of their statements, and I think that those 4 words describe you guys to a T, and those were organization, collaboration, knowledge, and compassion. Documentation provided was highly organized and detailed, highlighting the staff's ability to manage resources and time. Excellent collaboration and support among the breastfeeding team. Staff are very knowledgeable and confident with their roles and job functions, and true compassion for WIC participants and provision of quality services were evident. Each local WIC program must be monitored by the state agency at least once every 2 federal fiscal years, and when cited with deficiencies, the local agency must submit a detailed CAP reflecting activities to permanently correct the cited deficiencies. They found 4 deficiencies on our review, and we're going to cover each one of those individually, but the first one was area 7.2. Does the local agency account for WIC program expenditures according to program requirements? Area 9.1 are required nutrition assessments completed for each certification period. Area 9.2 are all eligible nutrition risk criteria for each participant identified and being used correctly. And the final one, area 12.5, are women enrolled in the peer counselor program receiving the required number of contacts. So let's look at area 7.2 first, which that deals with fiscal management. And again, the question they asked there is, does the local agency account for WIC program expenditures according to program requirements? And the deficiency that they cited was that from conducting interviews with the WIC director and reviewing documentation provided for February 2020 WIC expenditures, it appears that salary allocation was not charged to the appropriate program activity budget. Administrative assistants should charge time to the nutrition education budget when conducting mini lessons. Now, I'm sure you've all noticed when you're doing your dailies, there used to be 5, but now there's 6 with COVID. But there are 5 main budget areas within WIC where you can put your time. They are general administration, client services, nutrition education, breastfeeding promotion, and peer counseling. How you enter your time should reflect what you're doing throughout the day. And for as long as I can remember, clerical staff have always entered 100% of their time in client services, but this really doesn't accurately reflect what you're doing. So when providing mini lessons, this time may be budgeted to nutrition education. The expectation comes from the WIC Manual, Chapter 12, Section 1. The nutrition education budget includes costs that relate directly to nutrition education. Examples of approved costs covered by the nutrition education funds includes personnel costs such as salary and fringe benefits for the provision of nutrition education. Each administrative support specialist 3 will calculate the amount of time spent daily in the provision of nutrition education through mini lessons, and this time will be entered into the daily time entry and analysis system, which is just the full name of the dailies. At the end of each month, the percentage of time spent will be multiplied by each employee's salary and fringe benefits, and that's something that Lori and I do, so you don't need to worry about that part. You'll just be entering your time. To monitor compliance, the nutrition program coordinator will monitor compliance through reviewing monthly entries by each staff in the local agency's daily time entry and analysis system. While we're providing services remotely, the clerks have not been providing mini lessons. Therefore, you should not be entering any time in nutrition education at this point. When we return to a new normal and you start doing mini lessons again, you can begin allocating an appropriate amount of time to the nutrition education budget line. But at this point, do not change anything about how you're entering your time until you hear otherwise from me. Area 9.1 are required nutrition assessments completed for each certification period, and the deficiency there was that in reviewing records 6 out of 15 records were missing diagnoses or conditions on the health information screen. Complete nutrition assessments address 5 areas, and those are anthropometric, biochemical, clinical, ecosocial, and dietary and physical activity. For participants and applicants who have medical conditions or a diagnosis, those should be documented in the health information screen and addressed in your nutrition summary. The expectation for this area comes from the WIC Manual, Chapter 6C, Section 1. Clinical health history disease status information is collected to assess medical and clinical indicators of nutrition risk, health history, and disease status. Health and disease conditions are evaluated for nutrition-related consequences. This information is documented under the Health Information Quick Link in Crossroads. Clinical information that is assessed includes but is not limited to, for pregnant and postpartum women, pregnancy-related conditions, pregnancy history, birth outcomes, medical conditions, substance use, use of medications, oral health status, and depression. For infants and children, presence of medical conditions, use of medications, immunization status, and oral health status. Diagnoses listed on medical documentation forms should be incorporated into the nutrition assessment and documented in Crossroads. An example of that would be failure to thrive. So if you receive medical documentation or a prescription for an exempt infant formula, such as Alimentum or Nutramigen, or a WIC eligible nutritional, such as Pediasure, it's going to have a medical diagnosis that documents why it is being prescribed. And this diagnosis must be documented in the health information screen. To monitor compliance, I will do that through part of the annual staff performance reviews, which are done in November, and the nutritionist will continue quarterly record reviews, and those will be done in February, May, August, and November. Area 9.2 are all eligible nutrition risk criteria for each participant identified, and are criteria being used correctly. The deficiency there was that in reviewing records, 3 out of 15 had missing risk codes. All eligible nutrition risk criteria must be identified and documented in the Crossroads record. And in most cases that were found during the review, the missing risk criteria went along with undocumented medical conditions and diagnoses. The expectation for this area can also be found in Section 6C, Section 1, Chapter 6C, Section 1. Staff must identify all applicable WIC nutrition risk criteria for each participant at each certification and subsequent certification. You can refer to Chapter 6C, Attachment 2 for a list of all the risk factors used to determine eligibility. The assigned risk factors quick link in the Crossroads system identifies risk factors and allows the nutritionist to add risk codes based on the interview, observation, and assessment performed. If you identify a risk criteria that the system did not assign, you need to manually enter it. Make sure if a participant has a codable medical diagnosis or condition, such as failure to thrive, reflux, anything like that, then the appropriate risk criteria should be assigned. To monitor compliance, it'll be done the same way as the previous area, through annual staff performance reviews and through nutritionists doing quarterly record reviews in February, May, August, and November. The final area where a deficiency was noted had to do with the peer counselor program, and were those participants receiving the required postpartum contacts. 3 out of 5 records reviewed were missing a required post-delivery contact. I've addressed this area individually with Evelyn, so I'm not going to cover it in detail with everyone, but if you're interested in knowing what the minimum required contacts are, those are outlined in the WIC Program Manual, Chapter 9, Section 6. And compliance will be monitored through monthly record reviews as part of the annual staff performance reviews. In addition to the 4 areas of deficiency, 3 recommendations were made by the review team. Recommendations don't require a written response in the CAP, but they're just suggestions that the reviewers think would improve our agency's services. The first one was in the area of processing standards. Appointments should only be given outside of processing standards when the date is requested by an applicant or caregiver. The reason the appointment was made outside of processing standards must be documented in Crossroads. It's rare when we don't have an appointment available in processing standards. If someone requests a date that falls outside of those parameters, then choose client request from the drop-down menu. Also document in an alert the reason why you scheduled the appointment outside of processing standards, such as work schedule, coordinate with a child, waiting for Medicaid, whatever the reason is. If there just isn't an appointment available, then you need to see Lori or me and have one added. Under no circumstance should you choose other as the reason from that drop-down menu. For the goals area, nutritionists should update assigned goals as needed. It is not necessary to assign a new goal with each nutrition assessment. A previously assigned goal may be updated to reflect the status and date change to align with the date of the nutrition assessment. Previously assigned goals need to be reassessed at subsequent visits, and the status towards reaching that goal should be documented in the record. And then the final recommendation had to do with food packages. Food packages prescribed should match the feeding preferences that are documented in the participant's record. If there are any discrepancies, particularly with infants who are breastfeeding and receiving formula, make sure to document this in the care plan. Food prescriptions should match what the family is doing, and if it doesn't, you need to document why. For example, if a mom is mostly breastfeeding and giving a very small amount of formula, but she requests more formula than she's actually providing, then you need to have a discussion with her about what that supplementation is going to do to her breastfeeding, offer lactation services, and provide as little formula as possible if she still requests it. You should also note in your care plan why you issued more formula to an infant than what you recorded that they are actually taking. Okay, so what comes next? The first thing is CAP implementation, and that's happening this month. The first thing is this training that's being recorded, and you all are going to view it. The nutrition staff are going to begin their quarterly record reviews. Any findings will be communicated and followed up. Training will be provided, and I have passed all of those out to you guys. If you can get them back to me by the date that was indicated in the email. Monthly peer counselor record reviews will continue. And then the last area of the CAP was that clerical staff will begin documenting time in the nutrition ed budget when the provision of education resumes. At this time, again, do not change anything about how you're entering your time. Within 6 months of the monitoring event, so that'll be in May, Lee Ellen's going to conduct a visit, which will either be in person or virtual, with the local agency to review the documentation and implementation status of each activity within the approved CAP. Within 15 days of that visit, which confirms the CAP has been fully implemented as approved, she will send written correspondence to the local agency indicating the monitoring event is closed. So that will take place in June. And then finally in November, we will have our annual staff performance reviews. And then also each local agency must complete a self-assessment of program operations in the years in which they are not monitored by the state agency. So in November, we will have a local agency self-assessment. This is just the USDA non-discrimination statement. I want to say again that I truly, truly appreciate the work that you guys do every day and how well you do your job, your professionalism, knowledge, compassion, and just how well you work together makes my job easier, and I appreciate it immensely. There's a sign-in sheet on my round table. After you've watched this video, please come to my office to sign and date it. There will be handouts beside that sign-in sheet. Take one, please. It is just one page, front and back. And if you have any questions about anything that's been presented in this, then just see me or Lori. Thank you.